I woke up at 4 a.m. this morning with a itchy shin, and I was scratching it. And it's funny because at 4 a.m. you think malign thoughts. You think, this could be underlying. Why is it suddenly itchy? Dark thoughts at 4 a.m. is not uncommon. But I knew that it wasn't serious, and even then at 4 a.m. I knew that I wouldn't get a doctor's appointment because they're overrun, and you can't really get a doctor's appointment. You've got to go through so many different hoops and like requests, and the doctor would read that quite rightly and say he's got an itchy knee. What's the guy doing? So even if you have malign thoughts at 4 a.m, you just got to suck it up, really. But that's not to say that there might be an underlying health problem, and you do need to get seen. So Dr. Google is what you're left with, and you type it in, and you just get three answers: underlying health problem, condition, which makes you feel worse and you can't get back to sleep, or some skin condition, or old age. But I mean, if you've got the money, go private, which is what the government are trying to push people towards. And you go to the itchy clinic. I mean, there's bound to be an itchy clinic in Harley Street. Come in, and you get diagnosed and give them some cream. But that's what private clinics are good at, dealing with your itch. So, but most people can't afford private health, so then you're stuck with Dr. Google. But I do think there'll be a chatbot soon, AI that you could, with a nice soothing voice at 4 a.m, which will make you feel better, because you say, I got this itch and I couldn't get through to the doctor. No problem. When did you get the itch? How itchy is it? And these sort of questions, and then it'll say you've got some skin disorder, and if it doesn't go away in a week, call your doctor, which makes you feel better, or you've got some sort of underlying health condition, in which case you won't get back to sleep. But unless you can go to the itchy clinic, you're in a tough place, because 90% of the population can't afford the itchy clinic. So even if the government wants to push it private, you're stuck with the NHS, which is just completely overwhelmed, and they're not going to be interested in your itch. It's a bit of a dilemma. Cheers.